The main focus of my talk is a very large trial that we had the pleasure to work on called Head Positioning in Acute Stroke. And it was basically a trial to see whether we should be lying people flat or sitting them up in the acute phase of stroke. So it was a big global study with 114 centres across the world, 11,000 patients, and Lancashire Clinical Trials Unit that I'm the director for was the UK coordinating centre. And we recruited 41 sites in the UK and over 4,000 patients that had to be followed up at 3 months post-stroke. So it was a big undertaking. And the paper reporting the results ended up in the New England Journal. So it was all very worthwhile in terms of those things, but in terms of patient care it's very important because it gives us a clear message that we don't have to worry about whether we lie people down or sit them up in acute stroke. And although that may seem simplistic, there's huge variation in practice across the world. So in the UK we always sat everybody up. In Switzerland, they lie people down for the first 3 days, and in lower resource countries, they don't really have much choice about the way people are resting because they don't have such snazzy beds as we have that allow you to sit people up more comfortably. So it's a great message for nursing, one of the largest trials there's ever been in nursing care, and a great trial for results for stroke. One of the greatest things about nursing is not really in terms of technology, but it's in terms of people's position and empowerment. And I think over the last probably 5 or 10 years, people have realised that nurses, specialist nurses, can take a very important role in the delivery of services, whatever type of services that is. So although doctors have a very broad understanding of what can be wrong with people and what you need to do about it, nurses can develop very specialist understanding within a very discrete area and can therefore be pioneers in terms of delivering the right care to the right people at the right time. It's important to empower all nurses, but particularly in haematology, in all aspects of care. So I think it's important in terms of that specialist clinical role, but in performing a specialist clinical role, then nurses often notice things where the evidence is perhaps lacking, so there's a gap in the evidence, and they can raise very important questions that need to be researched. So they need to feel that they have a valid view and that they're empowered to raise those things. And then research can be promoted that's on very clinically important questions in haematology. So if they didn't feel empowered, then they might just keep those things to themselves, and then there wouldn't be the opportunity to do such important and clinically relevant research. It's very important for nurses to know what's new and to keep up to date. Because if you always do what you always did, then you'll always get what you always got. And that means that you won't know how to change things in the future. The other thing is that if you're going to change something, you need to be sure that the new is better than the old. And the only way of knowing really whether the new is better is to absolutely understand the evidence. So conferences like this can give you an idea of what the most up-to-date evidence tells us, and nurses need to get to grips with that and understand that. And this is a very good way of having a very concentrated few days of getting to grips with all that evidence.